Swadika, good morning and welcome to Newsline. I'm Cholapansa Navrula. And before we end this section, there is an interesting feature about refractive error from LaserVision. Refractive errors often are the main reason a person seeks the services of an optometrist or ophthalmologist. But what does it really mean when we are told that our vision is blurry because we have a refractive error? Kun Sotchir Limgunkai has more.
We see the world around us because of the way our eyes bend or refract light. Refractive errors are optical imperfections that prevent the eye from properly focusing light, causing blurred vision. The primary refractive errors are nearsightedness, farsightedness, and astigmatism. Refractive errors usually can be corrected with eyeglasses or contact lenses, or they can be permanently treated with LASIK and other vision correction surgery, or also called refractive surgery. At LaserVision, they offer several latest technology of LASIK. These technologies include LV Platinum LASIK, LV Optimized LASIK, and LV Premier LASIK. To understand more about each type of LASIK, let's ask LaserVision specialists to explain more about it for us.
Regarding the types of the LASIK, actually there are many types of LASIK. This can be classified into LASIK for nearsight, for farsight, and for astigmatism, including for presbyopia. And in each types of LASIK, there are still many subtypes that could be classified, such as in the LASIK for nearsight, farsight, and astigmatism. This can be classified to be the LV Premier, that is a very basic one. LV Optimized, a little bit more advanced, and the Platinum, the most advanced one, including the aspheric and wavefront technology together. For the presbyopia, we also have the subtypes of presby LASIK. We also have the NV LASIK. These are very different in detail, but both of them are for the presbyopia. And this is the types and subtypes of the LASIK that can be classified shortly.
However, all patients are recommended to have an evaluation from refractive surgery specialists. Each person's eye is different, and also the reaction of the laser on each person's eye tissue. Pre-surgical evaluation is necessary so that the right LASIK technology could be chosen for you. Tune in for more stories about latest innovations for eye treatment.
We'll learn more about different types of LASIK treatments in our upcoming special interview with LaserVision Medical Director Anun Vongthongsri. He'll be giving us an in-depth knowledge of LASIK treatment.
LaserVision International LASIK Center, the leader in femto LASIK.
Eye problems like nearsightedness, farsightedness, or even astigmatism are very common problems, and these problems can be tossed away. To find out more about the treatments, today we're joined by the medical doctor of LaserVision International LASIK Center, Dr.Anun Vongthongsri. Swadika.
Swadika.
Thank you very much for joining us today, doctor. Yes. First of all, tell us a bit about the LASIK surgery operation. What are the processes involved in this operation?
Regarding the LASIK operation, there are two major steps. The first step including creating the corneal flap. The second step gonna be doing the laser to reshape the cornea. Why? Because at the first step we have to create the very thin corneal flap that is about 1/5 of the corneal thickness to be in the middle layer of the cornea, and then the second step we use a laser to reshape the cornea to achieve what we want, depend on what is the eyesight at the beginning.
I see. Now, is it able to cure all eye problems from farsightedness, nearsightedness, and even astigmatism?
Yes, the LASIK operation can be treated for nearsight, farsight, and astigmatism. Not only that, but also for the presbyopia. Presbyopia is the thing that the people cannot read up close when they get older, such as above 40 years old. That also can be treated by LASIK too.
So basically it can treat all the eye disorders.
Yeah, depend on the patient. If your eyesight and your eye condition is in a good condition, no matter what eyesight you have, we can do the LASIK to
Now, about the
treat
good condition, how would one know that this particular person is a good eye candidate to have a surgery?
That is need to be checked truly by the doctor. Depend on from the front part to the part behind your eye, from the eyelid to the cornea, the lens and the retina. These all need to be in a good condition. If you have something wrong in your eye, we probably not consider you are a good candidate for LASIK. We need to treat that disease before we can go on for the operation.
Doctor, a lot of people actually wonder that the eye disorders that we mentioned, are they actually considered as diseases?
Not really. We do not consider the eye condition as a disease because we don't need any medication or any operation for that. But we need some visual aids such as glasses, contact lens, and beside that, we still can use some operations such as LASIK to treat the eye condition. Why? Because with the glasses, with contact lens, we consider this is just a temporary visual aid. But for LASIK nowadays, we consider this is a permanent correction for this condition.
Now, how advanced is LASIK technology today? Because it has been in the industry for quite some time. I understand that there have been sort of some developments in the technology itself. Tell us a bit about the advancement today.
Yeah, because LASIK has been improved continuously for the last 10 years. There are very new advanced technology. So what we are talking about the new advanced technology for LASIK nowadays is something what we call the pattern of the LASIK treatment, because we reshape the cornea to correct the eyesight. So in the detail of reshaping the cornea, there is very delicate thing to do. So now we have a technology called aspheric treatment.
Aspheric?
Aspheric. So because the eye is not sphere, we call it as aspheric. So when we do at the beginning, when we do the laser, we make the eye to be sphere. That is not natural. Now we have the aspheric technology to make the cornea to be aspheric like natural. We also have the wavefront technology. The wavefront technology will create the eye to be more natural. Both of these technology will help to create the eye with very good eyesight in all light conditions, no matter the very bright or dark conditions, so that we can see clearly.
So it has become a lot more effective than before. Now, in terms of evaluating if a patient is a good candidate for having a LASIK surgery, just now you said if the patient does not have any eye problems, then they can go ahead with having the surgery.
Yes.
Does it mean that people of all ages, including children, teenagers, can do that too, doctor?
No. Because that we will do the LASIK, because as we have talked about that the LASIK is a permanent treatment. So we want to do, by principle, we want to do just one time and then give a permanent correction for the patient. So you know that because the children's eyesight is not stable, they're gonna increase or decrease by the time until we consider it's about 18 or 20 years of age before it can be stable.
I see.
Even in some adult that the eyesight is not stable by history or by the doctor evaluation, if that is not stable, we may postpone the operation to be some period of time that the eyesight is stable. So there is some limit for the children that cannot have the LASIK. For the age, for the older people, we have to check very carefully that if there is some cataract, the cataract is always happen in the older people. If the people don't have the cataract, then it's still good candidate for LASIK. But if they do have that, then there is another operation that need to be done in that case.
I see. So which means that if you were to have a LASIK surgery, it can only be done once?
Actually, it can be done more than once.
More than once?
One, but we like to do it just once.
Are there any side effects or any complications involved?
Yes, LASIK is just like any kind of operation in medicine. So any operation in this medicine could have some side effect or complication. However, compared to other operation, LASIK is very little complication and side effect. some mild side effects such as because that we create a corneal flap, there is some healing process of the eye. So at the beginning you may have some dryness of the eye, and this can be treated by some lubrication or what we call artificial tear for a period of time, and then you could be back to your baseline. Another side effect that quite often happen at the beginning of the operation is the glare or halo at night. You probably hear about something like this.
Yes.
The people who got LASIK, they cannot drive well at night, but because you are still in the dryness condition of the eye, you are still in the healing process, the cornea that has been reshaped is not back to the normal natural process.
But that is
yet.
just temporary.
That's temporary. There is very little chance that the patient could have that permanently, but because of the new advanced technology that we just talked about, this could lessen this complication.
So all in all, it's safe and it is effective.
Yeah, it's
so
very safe.
laser vision actually provides you with an opportunity to see the world again, this time without the visual aids, without the glasses. Dr. Anun, thank you very much for joining us today.
สวัสดีครับ